Hi, I'm Angela Marciano McCarthy, and this is a Diastasis Recti safe workout. It's great for postpartum moms. It's great if you have chronic back pain. It's what I start a lot of my patients with. I'm going to have you lie down onto your back, either lying on your side and rolling over if you have a diastasis, or just getting down comfortably onto your back. You're going to place both hands on your abdomen just above your pubic bone, as if you were sliding your hands into your pockets. Fingertips meet at the pubic bone. Thumbs meet just below your belly button. As you breathe in, notice the belly lift, and as you breathe out, notice the belly sink. You're going to try that a few times. Breathing in, belly lifts, breathing out, belly sinks. They don't have to be big, deep breaths. And then you're going to roll your pelvis back on the next exhale to flatten your back. Roll your pelvis forward to arch. Exhale and roll back. Inhale to roll forward. Exhale to roll back. Inhale to roll forward. Notice as you roll back how your hands tip up. You come into the middle, they're parallel, and as you roll forward, the hands tip down. Now you might not have that much motion in your spine. What you're going to do next is come into your neutral position. Hands are parallel to the ceiling. In that position, find the knobs in the front of your pelvis, that's the ASIS. Walk your fingers over about an inch. Imagine pulling your hip bones together and release. You're going to do that a few times. So that's turning on that deepest layer of abdominals, the transverse abdominis. Now bring your awareness to your sitting bones. Go ahead and squeeze your bum, really tighten your glutes, and then relax. So that's not what we're looking for. Those muscles should not contract. You're going to bring your awareness now to your pelvic floor. Hands on those knobs, walk a finger an inch over. Imagine pulling your sitting bones together, and then relax. You're going to do that a few times. Imagine pulling the sitting bones together and then relax completely. Inhale and exhale. Exhale to contract, inhale to relax. So you're thinking about those muscle fibers that run across the pelvic floor. Bringing your awareness now to the pubic bone and the tailbone. Imagine pulling the pubic bone towards the tailbone and then relax. Now bringing your awareness to the muscle fibers that run front to back. Again, the bum stays relaxed. If you're tilting your pelvis, squeezing your glutes, squeezing your inner thighs, cut your intensity back by half. What you're feeling for here is a light contraction of those deep abdominals because they're connected to the pelvic floor. The next thing you're going to do in your neutral position, feet together, inhale, knees apart, exhale, knees together. Excuse me. Inhale, knees apart, exhale, knees together. You're imagining pulling those hip bones together. Two more of these. Inhale, knees apart, exhale, knees together. And then alternate legs. Inhale, knees apart, exhale in. Inhale, left knee out to the side, exhale back to center. Inhale, right leg comes out, exhale back to center. Inhale, left leg out, exhale back to center. Keep going here. So the question on this one is always, how far should I go? You're going to go as far as you can without feeling like you're losing that midline contraction or rolling over to the side or letting your pelvis rock. So you're looking for stable spine and pelvis. Inhale apart, exhale together. Again, these muscles are pulling the hip bones together. They're going to stay on for this whole series, but they're not so tight that you can't breathe. Now marching, you're going to inhale, pick your right foot up like you're marching, exhale, lower it down. Inhale, pick the left leg up, exhale, lower it down. The goal is to move just from the hip joints. Imagine you have a brace on your knees. Sometimes I cheat on this one. And the next one, it's real common, but your goal is not to change the angle of the knee. Inhale, lift, exhale, lower. Inhale, lift, exhale, lower. Lightly pulling those hip bones together. One more time. Last one on the left. Okay, this is where it gets a little harder. You're going to bring the right leg up its tabletop, put the right hand on the knee, left leg comes up. What you don't want is your belly to pop or your back to arch. If you lost it a little bit, use your exhale, come back to neutral, pull those hip bones together. Inhale, release the right leg, exhale, bring it back up. Inhale, release the left leg, exhale, coming back up. Inhale, right leg, exhale, lift. Inhale, left leg, exhale, lift. If this is easy, lower your hands to your side. Inhale, right leg. Inhale, left leg, exhale, lift. Again, you don't want your belly to be doming up or rising. You're imagining pulling those hip bones together, but I'm talking a lot here so I can breathe, right? It's not about sucking your belly in. Now this next one, you can either stay with this, or if you're feeling really strong, you've been doing these for a while, you can do both legs together. Imagine zipping the legs up, inhale, lower, exhale, lift. The goal is to get the legs to the mat someday, maybe not today. You've really got to hold on to the spine and pelvis, okay? You don't want to see the pelvis roll forward and feel the back lift off the mat. That's what you'll see a lot of folks doing. So the goal is stable spine and pelvis, legs lower and lift. One last time, just as far as you feel comfortable, or you can stay with the march. Lower the right leg down, lower the left leg down, bend both knees, heels come close to your bum. Pelvic tilt so you flatten your back, press the hips up towards the ceiling, and roll back down. Pelvic tilt and lift. Now you can also do some of that sitting bones contract towards each other, and pubic bone to tailbone here. It's another great way to work the pelvic floor. Lower back down, pelvic tilt and lift. Sitting bones towards each other, pubic bone to tailbone. All 4 points together, lower back down, exhale and lift, sitting bones to pubic bone, sitting bones together, pubic bone to tailbone, lower back down. If that feels easy and you want more challenge, go ahead and press the hips up. Think about bringing those 4 points of the pelvic floor together. Imagine an elevator, pubic bone is the first floor, belly button is the second floor, rib cage is the third floor. Pick the right foot up like you're marching, bring it back down. Pick the left foot up like you're marching. Bring it back down. Lower the hips back down and release. Exhale, tilt, lift. Bring that elevator up to the third floor. Right foot, hips don't dip or twist, they stay level. Left foot, lift that leg lower with control. So this may be too hard. Just stay with the bridge if you can't add the march until you get stronger. A couple more of these. Lower back down. Pelvic tilt, lift. March, march, lower back down. Bring the feet together, arms out to the side. Inhale, both knees to the right side. Exhale, twist back to center. Inhale, both knees to the left. Exhale, twist back to center. Inhale, both knees to the right. Thinking about pulling those 2 hip bones together in the front. Inhale, legs to the left. Exhale, twist back to center. Roll onto your side. Come on up into sitting. And that's it for the back lying series of exercises.